So today we will talk about the examination of breast lump. Before starting the examination of breast, first of all, you should introduce yourself to the patient, take informed consent from the patient, explain all the steps of examination to the patient, and expose the patient. And a proper positioning is the sitting position with the hands placed on the back of the head so that both the breasts become properly visible. The next step is the inspection. An inspection look for the breast symmetry, which means that either both the breast lies at the same level or not. Then look at the nipple alveolar complex area. Also inspect for nipple retraction on both sides of the breast, and also look for any visible skin changes like signs of inflammations that include redness, any stretch marks, or any kind of pigmentation on both sides of the breast. Then also look for any scar marks, visible veins. Also look for any visible lump in all the four quadrants of the breast bilaterally, and if the lump is present, then look for the size, and shape of the lump. Also look for any visible swelling in the supraclavicular, infraclavicular, and axillary area, which indicate the lymph node enlargement in the CA patient. The next step is palpation. So in palpation, first of all check the temperature with back of your hand of both the breast. Then do superficial palpation of the breast. In superficial palpation, we look for any tenderness while looking at the face of the patient, and superficially palpate the breast in all the four quadrants bilaterally. After superficial palpation, then deeply palpate the breast in all the four quadrants bilaterally to look for any lump, and also palpate the nipple alveolar complex area, and also press both the nipples to look for any discharge, and if the discharge is present, either it is serous in nature or transparent, and if there is any visible lump in the breast, then examine the site of the lump, size of the lump, shape of the lump. Also check the margin, either they are regular or irregular. Also examine the surface of the lump, that either it is smooth or not. Also examine the mobility of the lump, that either the lump is mobile or not, and also look for the consistency, means that either the lump is soft or hard. Then perform the transillumination test with the torch, and look for whether the lump is cystic or hard. After that, perform the skin pinch test on the breast lump to check whether the lump is attached to the underlying skin or not. And after a skin pinch test, perform the fluctuation test, which is done with the help of two fingers that are placed at right angle with each other, and push with one finger on the lump and feel it with the other lump, which is placed perpendicularly, to look for any fluctuation in the lump. Then at the end, examine the lymph nodes and the supraclavicular area, infraclavicular area, cervical area, and in the axillary lymph nodes area to look for any enlargement of the lymph node, which indicates the C of the breast. And at the end, cover the patient and say thanks. So it was all about the examination of a breast lump.